You are tuned into Fever 104 FM with me, Shayan, and right now sitting next to me is Dr. Sreekanth Shetty, Head of Cardiology at Sakra World Hospital. So first of all, thank you so much for taking time out and coming here. Just to put things in perspective for people who are listening, right before the interview began, I asked, sir, what are your typical working hours? Because I want to put things in perspective for the rest of us non-medical professional. He says a typical working day, which is not even a busy day, is about 9 to 9, right? 9 o'clock in the morning till 9 o'clock in the night. And then a lot of us complain that, oh, we've worked 8 hours. Okay, but doctor, on World Heart Day this time, can you talk about small risk factors that people ignore when it comes to their cardiac health?
In fact, this year, the theme for World Heart Day is Don't Miss a Beat. And it is focused on young people because globally and particularly in India, currently we are concerned about heart disease amongst the young. We keep talking about that a lot.
Right.
And at all ages, obviously, prevention is a very important consideration. Now, when we speak about heart disease in the young, we may not see the classical risk factors of heart disease that we associate with older people, like diabetes or blood pressure or cholesterol and all that. So what's more important in younger individuals, like you said, small things that you tend to ignore. Long working hours, night shifts, not having adequate sleep. In fact, the WHO now recognizes inadequate sleep as an important contributor to heart disease as much as, let's say, diabetes or blood pressure is. So,
as I listen to you saying all of this, I feel that a doctor must go through all of these, all of these things.
Yeah, so I know, but then the fact that our patients need us keeps us going. And pollution. 1 minute, so easily associate pollution with heart diseases, but particulate pollution particularly increases heart attack risk. So at any age, even a young individual who is exposed to particulate pollution exposes himself to a higher risk of heart disease. And that's also why you see that heart attack incidence keeps fluctuating, depending upon the weather conditions and depending upon the ambient pollution levels and all that. So people who travel a lot in this heavy traffic, exposing themselves to heavy pollution, people who live alongside highways or airports, these people have a higher risk of developing cardiovascular diseases. So since you ask what are the small things that we tend to ignore as causes of heart disease, these are what they are. So which we need to pay attention to protect ourselves.
I was just reading an article before you walked into the room, and this spoke about the fact that can sleeping on a particular side have any relation or connection with heart health? Do you agree with that, if we sleep on the right side or the left side?
I don't think there is so much evidence connection, but there are specific situations where sleep position may influence your heart health. For example, if you have a condition called sleep apnea, where your airway is narrow, especially if you lie down flat, these patients who are snorers, their airways are better open when they sleep onto one side or to other. And sleep apnea is a risk factor for heart disease. It increases your blood pressure, it increases chances of heart arrhythmias, congestive heart failure, stroke and all that. So sleep hygiene, sleep duration, sleep quality, and also sleep disorders like sleep apnea, these are all very important to recognize and treat. Position, it is said that if you have a hiatus hernia, for example, where the part of the stomach is up into the chest, if you sleep onto your right side, there is a gravitational predilection for more acid reflux, and that disturbs sleep as well. You can have reflux-induced bronchospasm and so on. Other than that, sleep position itself may not impact your heart health.
Alright, for somebody out there who is maybe a little worried about their heart health, maybe the person has not suffered anything as yet, but if people want, along with eating as clean as they can, what are the other things that people should do that will keep their heart in tip-top shape?
One of the most important considerations is mental health. So stress and anxiety have indirect bearings on heart health. So paying attention to mental health is important. Spending good time, quality time with family is important. Good work-life balance is important.
Right.
And then you have to exercise at least 5 days a week, and the recommended intensity is that you should exercise for about 150 minutes a week, and 2 days a week you should also do some weight training. These things help your heart health. And don't smoke. As far as smoking is concerned, there is no threshold for harm. It means that even a single cigarette is bad. Avoid alcohol. And this might sound like a cliche, but diet is an important factor in determining cardiovascular health. So a proper diet that is rich in fruits, vegetables, whole grains, fatty fish. These things are important. Complex carbohydrates, avoid sugars, avoid saturated fats and trans fatty acids, junk and all that. So calorie restriction and maintaining an ideal body weight. And regular checkups, of course. Because we know blood pressure, diabetes, cholesterol, we call them silent killers because unless you check, you wouldn't know.
Right.
So you can have somebody walking around with a blood pressure of 200 and 120 and he doesn't even know. But from the inside it will keep doing its damage. So beyond the age of 20 years, even earlier probably if you have a family history, doing regular health checkups and finding out if you have any of these traditionally understood coronary risk factors, and then if they are there, then addressing them depending upon the level of your risk on the advice of your physician, with medicines or without medicines if it is okay at lower levels, along with appropriate lifestyle changes is important because a person who has a heart attack at the age of, let's say, 45 or 50 will most often be in an untreated blood pressure or cholesterol patient for a long time. So start early, work on it diligently so that future heart diseases and strokes are prevented.
All right, sir. Thank you so much for your time. I don't want to take up too much of your time. You've got an extremely busy schedule. Wishing you a very happy World Heart Day. You've already given us a lot of messages, but if there is one line that you would want to leave people with, as on social media they say the TLDR version, which is too long, didn't read. If there is one line that you would want to tell people before you take your leave.
Your heart beats for you, so the least you can do is to take care of it.
All right, simple and sweet. Thank you so much, sir. It was lovely chatting with you and I hope you have a great day ahead of you.
Thank you.
I am sitting here with Dr. Adil Sadiq, Director of Cardiac Surgery at Sakra World Hospital. First of all, sir, thank you so much for taking time out what I assume is an immensely busy schedule. And as I do this interview, I know that you're in between surgeries and in between work. So thank you for giving us your time.
That is correct. Thank you so much. It's a pleasure to being on the show.
My pleasure, sir. On the occasion of World Heart Day, I have one small question, very basic question, and that is for people listening in or watching this. What are the signs that they should look out for, which should nudge them towards a doctor?
You know, this is a very commonly asked question. Many people who do not have chest pain come up to me and say, I really don't have any chest pain. I think chest pain has been overrated right from your Amitabh Bachchan and Rajesh Khanna movies. It doesn't happen. Chest pain is a symptom in only 30% of people, whereas the most common symptom is actually shortness of breath. If you're doing some kind of activity that you're used to and you can't keep up with it and you're running out of breath, that's a warning symptom. Your legs swell up, you have palpitations, or you have lightheadedness. All these are symptoms that may indicate that you have some kind of heart problem.
All right, so now these can be temporary things as well, like for example, shortness of breath. How can one understand that, okay, this is maybe a sign of heart disease, and then maybe, okay, this is just normal?
Well, if you're having shortness of breath and you're a male and you do not have a pretty woman around you, then that's a earmark for something that's happening. So it's in context. I mean, if you're just climbing one flight of stairs and you're short of breath, that's an issue. If you're trekking to base camp and you're short of breath, that's okay.
All right, very good. Now, technology is taking great leaps every single year. Can you talk about what's one big change that has happened in Sakra World Hospital and that has improved patient care?
Yeah, I think technology is everywhere, whether you like it or not, whether it's mobile phones, it's televisions, it's the way we watch TV, and of course, heart surgery as well. So one of the really breakthrough things that we've encountered is robotic heart surgery. It's not new, but it's kind of like revamped, re-engineered and improved, so much so that almost 60 to 70% of our patients are now candidates for robotic heart surgery. And with the help of these robotic heart surgeries, we can make sure that they have better outcomes, lesser stay in hospital, less pain, less bleeding, less infection. Cosmesis, or the way the incision looks, the small incision, that's the least important of things. That's the last effect. But faster return to normal activity, even in people who are septuagenarians, that's something that needs to take into account too.
Okay, is exercise really important for our heart health? Is walking for middle-aged adults a good enough exercise for heart health, or should that one?
Well, I mean, the question is analogous to having common sense, but let me put it this way. Let's take a car. It's a Ferrari. It's like 1.5 to CR car. Now you buy the car, you keep it in your garage, you turn it on every day, and then you shut it down. What do you think is going to happen to it? Vis-a-vis, you take the car out for a long drive every single day. So our heart is like that engine of the Ferrari. When you're born, you need to give it some running. You need to take it on the run. You need to take it on the go and keep it moving. And that's what walking does.
All right. Well, most of our hearts, unfortunately, probably not are in the Ferrari condition. It's a 1963 vehicle, which has gone through much wear and tear. Unfortunately, probably that's the case. Okay, but if you want to tell, before I let you go, sir, if there is one message that you would want people, one thing that people should 120% pay a lot of attention to when it comes to their heart health, what would that be, sir?
And this is that, I think we need to understand the risk factors of heart disease. And I always keep telling people this, the biggest risk factor ever is ignorance. Ignoring the fact that you can have heart disease, ignoring the symptoms of heart disease, ignoring medical treatment when you know something's going wrong, that is the biggest risk factor. So, and that brings us back to this year's World Heart Day, and you need to take action when it counts and before it actually becomes a bigger problem. So, the old adage, a stitch in 9 saves 9, actually makes a big difference.
All right, Dr. Adil, Sadiq, thank you so much for speaking to us in Fever 104 FM. It's a short but a very lovely interview, and we got to learn a lot of things. And thank you for explaining everything with an analogy. I think that makes it very easier for people to understand.
Well, I certainly hope so. Well, thank you so much for inviting me on the show, and I think we'll get back to doing what I do best.
Absolutely. Thank you, sir. Thank you so much.
Take care. Bye-bye.
Right now, sitting next to me is Dr. Pradeep Kumar, interventional cardiologist at Sakra World Hospital. Sir, thank you so much for taking time out of what I imagine will be an immensely busy schedule and speaking to us.
Thank you. Thank you for the opportunity.
On World Heart Day, it's a pleasure and an honor to speak to you. As a cardiologist, you take care of the hearts of people in the city of Bengaluru, not the one which suffers romantic trouble, but the actual heart which is needed for us. So, can you tell people listening in, or maybe watching you on Instagram, there are a couple of warning signs that they should not overlook when it comes to taking care of their heart?
First and foremost, this World Heart Day is started in 2000, around 29th of September, because of the increased incidence of heart disease. And specifically, though it encompasses a large variety of diseases, we are focusing on what we call ischemic heart disease, or heart attacks and strokes.
Right.
So this particular entity, which is a heart attack and blockages in the blood supply, usually announces itself by some kind of effort intolerance. So people who are actually active, who are exercising, who are moving around, will find some difficulty in doing that, because they'll find if somebody is running, say 5 kilometers, they start finding it difficult to do even a kilometer, and they start experiencing pain, or somebody climbing upstairs starts developing some kind of pressure or pain or burning in the chest,
right,
which prevents them from continuing the activity, and then they have to stop. And if the symptom reduces immediately on stopping within 3-4 minutes, it is very, very likely to be cardiac.
Okay.
We have a large number of patients who come to us who have these kind of symptoms, and they think it is gas. So it is like gas is the predominant thing that most of them think can sit over heart attacks and heart problems. So any kind of chest discomfort, especially if it comes on exertion, should alert the patient. Rarely it can be only breathlessness without chest pain. Sometimes it can be loss of consciousness. And sometimes it can be only palpitations on exertion. So all of these things should alert the patient or any person that they could probably having a cardiac problem.
Tell me something, there are a lot of these things on social media which says these foods are good for your brain. Is there any kind of food or combination of foods that you would say are very good for your heart?
So more than foods that are good, we should be aware of what is not good.
Okay.
So what is not good is fats, especially saturated fats and trans fats. So these are things that you should avoid. So things that are made out of vanaspati, made out of ghee and palm oil, coconut oil, reused oil, and things in sweets and samosas, pakoras. These are all things that I actually have increased levels of trans fats as well as increased saturated fats. Thus, it's not that fat should not be consumed. It should be less than 10% of our calorie intake. It should not constitute more than that. Fats are important for body function, are important for multiple other synthesis that happens inside the body, for cell synthesis, cell wall, everything is important. But anything in excess is bad. So we should avoid oily food, deep fried food, fast food. These things should be done in moderation. If that shouldn't be your predominant, we have a lot of people who eat only those kind of foods.
Right.
Now, what is healthy for the heart are in fact our traditional foods like millets, ragi. These are good for us. Fruits, vegetables, things like avocados, legumes, all of these are good for health. Avoiding processed food, fatty food, cream, butter, bakery products, these are very important.
Let me ask a follow-up question. You spoke about coconut oil also not being that good for our heart. What oil would you recommend us to use for our day-to-day cooking?
The oil is always a controversial topic. Like, if I say coconut oil, there'll be some people coming with a small study and saying coconut oil is good.
Right.
There'll be people saying that ghee is good. More than the type of oil, it is the quantity. Like I told you, it should be 10% of our overall calorie intake. So even if you are using coconut oil, even if you are using ghee, use it in moderation, use it in very small quantities. If you are looking at heart healthy oils, olive oil or groundnut oil or even sesame oil, these are all oils that can be used. Again, the bottom line is moderation.
Alright, so technology has been getting better at a very fast pace. So can you talk about how Sakra World Hospital is embracing technology and that has improved cardiac care for people?
So the first things is in diagnostics, like when the main thing for any doctor, from the beginning, is you diagnose a disease. Right. Treatment is easy. It's usually once to diagnose the disease is difficult. Then treatment is more or less there. It goes along certain formats. So in diagnostics, from the non-invasive testing in terms of our echo lab, our non-invasive testing, our arrhythmia lab, every of this has been updated, and we can find out diseases much before it manifests. Things like a CT angiogram, which is now commonplace, but still have been started from a long time. So CT angiogram, which can detect blockages and things in people who have moderate risk of developing these. Not everybody needs a CT angiogram. With people who have an intermediate likelihood of having problems have to be tested. Now we don't say everybody or over 40 should need it. Specific subset should need those kind of tests. And as far as the interventional work goes, we have got an advanced cath lab, advanced imagery, advanced treatments for even complex diseases. So all this has been incorporated, and we end up doing, treating the entire gamut of cardiovascular disease.
All right, Dr. Pradeep Kumar, thank you so much for speaking to us on Fever 104 FM. I wish you a very happy World Heart Day. Is there any one message you want to leave people with?
The thing with World Heart Day is to educate people to adopt healthy lifestyle. Second thing is to create awareness that heart disease is now the leading cause of death in India. Gone are the days when it was infection and TB and all those things. Now heart disease causes almost 1/3 of deaths in India. So it is a lifestyle disease. It is a preventable disease. So prevention is very, very, before you come, you shouldn't reach the hospital. Before that, adopt a healthy lifestyle, eat healthy, exercise regularly, and most importantly to the younger patients, don't smoke, and somebody who's smoking, stop smoking.
All right, sir. Thank you so much.
Thank you.
Hi, I'm sitting here with Dr. Deepak Gowda, consultant cardiac surgeon at Sakra World Hospital. So first of all, thank you so much for speaking to us on Fever 104 FM.
Thank you for inviting.
Oh, it's our pleasure, sir. On the occasion of World Heart Day, because I'm meeting a cardiac surgeon, I got to ask you this question. What are the early signs? This is very basic, but what are the early signs that nobody should ever overlook when it comes to their heart health?
So this is one of the important questions which people ask me, and nowadays, because of the development of heart diseases in very young, and we see and read in newspapers that very young people are dying because of heart disease, heart attack or something. So this is a very important question which we need to address. The only thing is the symptoms, vague symptoms, may be vague as simple nausea feeling, backache, and people who experience a little angina pain like thing when they go to little up climbing of stairs or doing strenuous activities. These are the things which you shouldn't neglect in your life. So these are the early signs of maybe a heart attack which you need to be more careful of. So as soon as you get these symptoms, you just need to go to a cardiologist and get yourself evaluated with your heart.
If you're going upstairs, if you're doing activity and during that, if you're getting a chest pain, that's when you should go for that.
Yes, that's true. And even generalized tiredness from past few days, even those are the symptoms which tell that you may be having an underlying heart disease.
All right, let me ask you a question. Because hearing you, I just came up with this question. So, is too much caffeine intake? Let's say a lot of people right now are looking at consuming a lot of caffeine because that apparently makes them better at work. I do that as well. So.
Yeah.
But is too much caffeine consumption, is that harmful for our heart? Can that make it dangerous for our heart?
Too much caffeine intake is not directly a causative factor of any of your heart diseases, but excessive caffeine intake is known to cause palpitations, excessive heartbeat, so which a person may complain of. So that is one of the linking factors for palpitations. Otherwise, it's not directly related to any of the heart diseases.
All right. And what about your LDL and HDL and stuff like that? I recently did a medical test, and there are a lot of figures which I honestly don't understand.
Correct.
And since we don't have an access to doctor 24/7, a lot of us are going to ChatGPT to understand the medical report. So, can you talk about a couple of factors, a couple of readings which are very important in one's health report when it comes to our heart health?
So when it comes to heart health, you need to know your numbers. That's very true. Numbers, I mean by your blood sugars, your blood pressure, your cholesterol levels. These are the numbers which everyone needs to know routinely with the annual health check. Coming to cholesterol, when we see the cholesterol report, we see various parameters like total cholesterol, triglyceride, LDL, HDL, VLDL. So these are the various cholesterols present in our body. Few of them are good, that is HDL is a good cholesterol, and bad cholesterols are triglycerides, total cholesterol, and LDL are the bad cholesterols. So LDL is main cholesterol which needs to be under check. Yes. And triglycerides, these are the numbers which you need to consult your cardiologist and keep it very well under control. If it's not under control, you need to start on medicines.
And when you set the number, does that vary according to different people, or is there a set number that, hey, if your LDL is, I don't know what the number is, over 140 or something like that, then it's a real issue? Or if it's less than 130, 140, it's not, it might develop itself.
So the latest guideline says the LDL has to be below, it should be a double digit, less than 70 should be ideal one. Okay. And triglycerides 190 to 200 depending on the lab where you get checked. And these are the numbers which have to be your levels have to be below these numbers.
Alright, so with technology taking a leap every year, can you talk about any breakthroughs at Sakra World Hospital that has improved patient care, that has improved chances of people getting back to the normal lives?
Coming to this question, I think I'm proud to say that we stand apart from any other hospital in saying that we are the fastest 500 doing robotic cardiac surgeries in the world. So we have done the fastest 500 in the world, and we are the highest number of robotic cardiac surgeries in the city and in the state. So coming to AI, so even every field's taking AI into their thing and then getting themselves more improvised. Even we are not behind. in cardiac surgery also we use artificial intelligence, that is the robotics. And then by robotics, what I mean is how it is much better than the conventional heart surgery is with robotic the cut obviously is less, and the blood transfusion is less. The recovery to work is much better, and the pain what the patient experiences is less. So these robotics have made a major difference in the outcomes in terms of cardiac surgical outcomes, and we are the highest numbers doing this routinely. And even the other surgery, next level of that is called a minimally invasive cardiac surgery, MICS. So coming to the valve replacements, the other tumors of the heart which can be accessed, a hole in the heart can be done through a minimally invasive or a robotic approach, which has made a tremendous difference in the recovery of these patients.
All right. Dr. Deepak Gowda, thank you so much for sharing all this info with us. That is going to come in handy for all of us. And well, on behalf of Fever and their listeners, I wish you a very happy World Heart Day.
Thank you, and same to you.
Thank you, sir. Thank you so much.
Thank you.
Right now, I'm sitting with the head of cardiac anesthesia senior consultant, Dr. Sunil Kumar NK. So, thank you so much for speaking to us on Fever 104 FM.
Thank you very much.
Now, when we speak about a cardiac surgeon, people generally have an idea what they do. What can you explain? I mean, we also have a general idea what an anesthesian does, if that's the way to put it. But can you explain your job for us once, sir?
So we always play behind the scene roles.
Right.
Actually, we play a very important role in cardiac surgery. Like for instance, like Dr. Adil does, any cardiac surgeon does minimally invasive or robotic surgeries. We play a very crucial role which needs special expertise to take care of what you call one lung ventilation, and allow the surgeon to operate on a heart with a small keyhole.
Okay.
Yes, and make sure that throughout surgery to make patients safe. That's very important. That needs a special expertise.
All right. Now, I have to ask you a question that how do we make sure that patients don't reach your operating table? What are the small warning signs that they should probably not overlook that you would want to tell people about on World Heart Day?
So for any disease, disease, prevention is the best.
Right.
Okay, it's always better to avoid going through all this and take care of your health first. Okay, on a World Heart Day, healthy heart is healthy life.
Correct.
Okay, take care of your heart. Heart works hard for you, and you have to work harder for it. Okay, have a balanced diet, have a regular exercise, and then if you are a known hypertensive and diabetic, keep it under control. See your doctor on time. Follow the instructions and take care of your heart.
All right. Can you tell me any sign, any warning sign that people should look out for, that if they are experiencing that, they would know, okay, maybe it is time for me to go to a doctor?
So sometimes it's not just a chest pain which alerts you that you have a heart problem. No, sometimes it's just a generalized tiredness. You have a hypertension, diabetes. Keep it under control. Sometimes it must be a generalized tiredness is what give you a warning sign. Okay, go to that. Have a regular health checkup, especially when you're 40 plus. Make sure that you follow strict diet control and regular health checkup.
All right, Dr. Sunil Kumar, thank you so much for taking time out and speaking to us. Before you leave, if there is any one message that you would want to give to people, I know you've already given that, but if you could leave them with a short one message on World Heart Day, what would that be?
Take care of your heart, the heart will take care of you. Have a healthy heart, healthy and happy life.
All right. So thank you so much. Thank you so much for your time.
Thank you.
Wish you a great day ahead, sir.
Thank you so much.
Sitting next to me is Dr. Rowena Asirvatham, Junior Resident at Department of Cardiac Surgery at Sakra World Hospital. Ma'am, first of all, thank you so much for taking time out and speaking to us.
Thank you for having me.
Now, on the occasion of World Heart Day, my questions are going to be pretty simple, right? Because it's difficult for us to follow complex suggestions and hints and stuff from doctors. So we'll keep it very simple. Can you talk about certain risk factors, certain signs that people should look out for, and when they experience that, they should immediately rush to a doctor?
So we call this early warning signs.
Right.
So when we talk about early warning signs, they can be very subtle. So few examples are chest discomfort. It could be tightness or pain, nausea, vomiting, lightheadedness, breathlessness, and pain in any other part of the body, say neck, jaw, shoulder, arms. So these are some subtle signs that one should never ignore.
All right. Now, when you talk about these signs, people also go for health checkups, right? Now, these signs might also be a signal to some other thing, like say nausea could also come from the food we have eaten. Like for example, tiredness might also come from a busy schedule. So often it becomes difficult for people to understand that, hey, is this a sign of heart disease or is this normal? So let me get to a health report scenario. A lot of people go for health checkups nowadays. I've also gone recently for my health checkup. Can you talk about important numbers in that health checkup report that will matter with heart health?
Okay, so when it comes to cardiac care, the important tests that you would carry out is ECG, and then comes an echo, and then you do something called a TMT, a treadmill test, where there is a treadmill with leads connected on your chest and you run on that. Then comes an angiogram. That depends on what your TMT says. And now, in between TMT and an angiogram, we do have other methodologies as well, like say a CT scan that identifies or measures the calcium in your blood vessels, and that will tell us whether it is significant for you to go ahead with an angiogram or not.
Okay, so let me ask you this question, in that case, what are the tests that everybody should do so that they know about their heart health? The basic tests.
So in earlier days, we used to have a cutoff of say 60 years. So when you say I'm diabetic, that means by default you're 60 and above. But in current scenario, the present generation, it's not like that. So my recommendation would be anybody who is above the age of 30 must undergo a complete thorough health check. So that will include all the system blood tests, which will also include your lipid profile and renal parameters, and also an ECG and echo and TMT. So this is a must.
Speaking about echo and TMT, can you talk about technological advancements in cardiac care, some of which Sakra World Hospital has embraced and which has improved patient care?
I come from the cardiac surgery department. So a remarkable advancement in my department is earlier, after doing a bypass surgery, if you have to check if your bypasses are working fine, you have to do an angiogram again, which means introducing dye again, which is a threat for your kidneys and all that. Now, recently, we can check the bypasses immediately before the patient comes out of the OT. We can check if the bypasses are flowing fine through sound. It's called a flow meter. So with that instrument, you can check if your bypasses are flowing fine, and it gives a printed value. And this is one remarkable advancement in Sakra.
All right, Dr. Rowena, thank you so much for taking time out and speaking to us. I wish you a great day ahead and very happy World Heart Day to you.
Thank you.
Fever FM.